I saw that there was some gap in our healthcare system where refugees didn't really have a place to go specifically dedicated for them, where it's safe and they feel comfortable. Right now, within the past 6 months, our patient population doubled. The only thing that we absolutely need to have is that our patients are refugees. That means they have a refugee status from the Department of Health. And the second thing is that they are uninsured.
When the patient comes in, they're seen by a team. They present to the attending and we go back in the room, examine the patient, formulate the final treatment plan. The students are always supervised.
About 80% of our population speak a different language and we need a translator, interpreters to come and help us.
And they can talk to them sometimes in English, sometimes in their own language. And we have students that speak Ukrainian, Spanish, whatever it may be.
We've started new programming in order to meet the needs of our patients. So after we met a sweet Afghani mom who had difficulty feeding her 2 young boys, we thought it would be great to help alleviate some of those issues. And so we started the Food as Medicine program, where we partner with a local nonprofit called The Well to give food to our patients after every appointment. And to date, we've distributed over 1,000 pounds of food. 10 years down the line, I definitely want to see Refugee Clinic continuing its incredible momentum of growth. We've also not only added on different lines of services, but we've also increased the number of clinics we do from once a month to twice a month.
We have a strong sense of community here at USF. And if you ever wish to donate, please go to our website, and anything is appreciated.
We are just extraordinarily grateful for the support that we receive from USF Health and all the faculty and students that make this possible.